Seroquel is prescribed to manage manic episodes in bipolar disorder, but it has the FDA's most serious boxed warning for life-threatening risks. Beyond that, many users face significant changes like major weight gain, and some effects like uncontrollable physical tics can even become permanent. We'll break down what you need to know, from metabolic shifts to neurological risks and the dangers of stopping. So what are the first changes many people notice? Severe drowsiness, dizziness, and a dry mouth are the most common. But the most impactful is often weight gain. Studies show nearly 1 in 4 people gained 7% or more of their body weight. This is not just willpower. The drug can increase appetite while altering how your body processes sugar and stores fat. This change in sugar processing points to a bigger issue. What is Seroquel doing to your blood sugar and diabetes risk? It's a full-spectrum metabolic shift. Long-term use is tied to unhealthy changes in cholesterol and triglycerides. So you have weight gain, blood sugar problems, and cholesterol changes. Serious long-term health concerns that need monitoring. The metabolic system is one concern. The nervous system is another. Let's examine the severe neurological side effects. The most frightening is tardive dyskinesia. This causes uncontrollable motions of the face, jaw, and tongue, affecting speech and eating. What this means for you. The movements may be permanent, even if you stop the medication. This is because brain dopamine receptors become oversensitive. Another serious risk is neuroleptic malignant syndrome. This medical emergency causes high fever, rigid muscles, and altered mental state. Remember the question about blood sugar? Seroquel can cause hyperglycemia, even without a history of diabetes, potentially leading to a formal diagnosis. The risks reach the heart's electrical system. Seroquel can cause QT prolongation, a rhythm change that can lead to dangerous arrhythmias. These risks are not equal for everyone. Certain groups face much higher dangers, particularly the young, the elderly, and pregnant women. For people under 25, the FDA warns of an increased risk of suicidal thoughts and behaviors. For elderly patients with dementia, there's a higher risk of death from stroke, heart failure, or infections. Newborns exposed in the 3rd trimester may suffer withdrawal symptoms and movement problems after birth. This proves that prescribing Seroquel involves a careful calculation of risk versus benefit that changes based on age and condition. Physical risks are one thing, but how does it affect your thinking, and what happens if you stop? This is where the choice gets harder. Seroquel can directly impact cognition. Users report impaired judgment, memory issues, and reduced alertness affecting daily life. This mental fog, paired with dizziness and potential drops in blood pressure, creates another danger, a significantly increased risk of falls. You might think, I'll just stop taking it. It is not that simple. Withdrawal can cause nausea, headache, irritability, and insomnia. Stopping suddenly, however, can be catastrophic. It can trigger hallucinations, delusions, and a return of suicidal thoughts. This creates a difficult trap. Now let's connect these different risks. The cognitive impairment we just discussed is not separate from the metabolic changes mentioned earlier. The physical lethargy from weight gain and blood sugar swings, combined with the mental fog, creates a cycle that can worsen the metabolic side effects. Let's revisit the increased risk of falls. This is not from just one thing. It's a combination of several factors. It's the dizziness, plus impaired judgment, plus sudden drops in blood pressure. This creates a perfect storm for accidents, especially for the elderly. The conclusion is clear. Seroquel can be vital for bipolar disorder, but its benefits must be weighed against a complex web of interconnected risks. This information is meant to empower you to have a deeply informed conversation with your doctor about your personal risks. Ask about regular monitoring of weight, blood sugar, and cholesterol. Discuss any new changes immediately. Never stop without a doctor's tapering schedule. If you or someone you know takes Seroquel, share this video. Understanding the full picture is the first step towards safe mental health treatment.